Hi, I am Dr. Rakesh, diabetes reversal expert from Dr. Heal Disease Reversal Center, HSR Layout, Bangalore. Today's topic is why people are finding difficulty in losing weight in spite of trying yoga, gym, everyday exercises, walking, and proper diet. In spite of this, why? Because we are having high levels of insulin in our body. Insulin is basically a storage hormone. It tries to store fat in the body. In the initial stages, it will store fat as a adipose in the adipose tissue below the skin. When a person reaches the personal fat threshold (PFT), then the insulin is trying to store fat in the visceral organs in the name of fatty liver, fatty pancreas, or a blockage in the heart and brain. So, if you try to reduce your insulin, then you are going to lose weight faster. So, what is the reason for high levels of insulin? This is a step deeper. So, main reason is repeated eating of high glycemic index food like refined sugars, refined carbohydrate, and ultra processed foods, and foods with less and lesser fibers. These foods, when you eat, it will spike up the insulin, and this is trying to maintain your insulin levels at the higher level always. So when you stop eating these refined sugars or these ultra processed foods, then your body's insulin level will be lower, and you will try to reduce your weight faster. And another reason why insulin is high because Randall cycle. What is Randall cycle? Randall cycle is there are three classifications of foods: protein, carbohydrate, and fat. So when you mix fat and carbohydrates in equal proportions, then that is going to store more fat in the body whenever there is a high levels of insulin. What is the mechanism behind it is when you eat equal quantities of carbohydrate and fat, immediate energy needs of the body will be catered by the carbs, and the fat which is there is never be understood by the body, and it will be directly going and storing in the adipose tissue or in the visceral organs whenever there is a high levels of insulin. So try to maintain low levels of insulin as much as possible so that you will lose your weight and you will maintain your weight in the whatever the targeted weight is by reducing repeated eating of high glycemic index foods and by reducing the fat and carbohydrate 50-50 ratio. You can use it 80-20 ratio, like adding some ghee into rice and sambar is not going to cause Randall cycle. But uh, having rice along with paneer butter masala, he will definitely make your Randall cycle and will maintain your weight and the higher level, and insulin is also higher level. So maintain your insulin at lower levels and you will be losing weight and you will be maintaining the weight. Thank you.